Hello everyone, myself Sriram K, Associate Professor in Department of Pharmacology. Today we are going to see the topic of systemic circulation. So, what is generally systemic circulation to? So, get into the topic. First is definition. So, what is systemic circulation? The portion of circulatory system that carries oxygenated blood from the heart to all body tissues and returns deoxygenated blood back to the heart. So this is the general definition of systemic circulation. So what happens in the circulation means the blood that are coming from the lungs, that is oxygenated blood, will pump the heart will pump the blood to the circulatory system, that is to all body tissues. So once this blood transferred to the body tissues, the body utilizes the oxygen. So once the oxygen is utilized, then the deoxygenated blood returns back to the heart. So this is the entire circulation. So this is circulation where the heart transfers the oxygenated blood to the tissues, then tissues return back the deoxygenated blood to the heart. So this is the total circulation of systemic circulation. It is also called as greater circulation or peripheral circulation. So, what is the key difference between the pulmonary circulation and the systemic circulation? So, this is high pressure, high resistance, and supplies every organ except lungs. So, this is the key difference between the circulations of pulmonary circulation and the systemic circulation. Going into the topic, this is the overall pathway. Okay, so where the initiation of the blood flow starts, that is from the left heart. Okay, so left heart to the body to the right heart. So generally a heart is composed of four chambers. So first the blood from the left ventricle flow into the aorta. So that is the oxygenated blood from the left ventricle going into the aorta. So the aorta will transfer the blood to the minute arteries. So this arteries then carries into the arterioles, then it will go into the capillaries. Okay, so in the capillaries, that is the minute blood vessels from which the gases nutrition exchanges are happening. Okay, so this is the circulation where the heart giving the blood to the tissues. Then after tissues utilized the oxygen, then the blood, deoxygenated blood, coming back to the venules, that is the smallest veins in the body, then it coming into the veins, then it comes to the superior and inferior vena cava just before the heart. Okay, then it goes into the right atrium. Okay, so this is the entire pathway. Okay, so this is how the blood flows in the, this is how the blood from the pure blood from the left ventricle travel into the body, then the deoxygenated blood comes back to the right atrium. Okay, so uh, this is the diagram that illustrates the complete pathway. So where it travels every each and every body parts. Okay, coming to the topic, that's aorta. That is the main highway. That is the main artery where the blood from the heart initially travels. The largest arteries in the body. Then four parts. It is divided into four parts. One is ascending aorta. So this gives off the coronary arteries to the heart muscle. Okay. Then aortic arch. Okay, this is the branches to head and upper limbs. Okay, so this is divided into three. That is branchiocephalic trunk that supplies to the right arm and the head. Then left common carotid, it supplies to the left side of the head. Then left subclavian, it supplies the blood to the left arm. So this is the three parts that arch of aortic arch supplies the blood. Then thoracic aorta. So this part supplies to the chest wall, esophagus, and bronchi. Then coming to the abdominal aorta, this supplies the abdominal organs, divides into common iliac arteries. So after going into the abdominal organs, it will be divided into iliac arteries. Then it will supply the blood throughout the system. Okay, so this is the uh, common arteries that are supplying to the body. Then atrial system. So generally arteries, so arteries are the blood that carries away from the heart. So generally arteries refers to the blood vessel which are taking the blood from the heart. Okay, so from the heart the blood will go out. So these all of these blood vessels carry blood away from the heart are called as arteries. So this is thick muscle wall, then it is branched repeatedly into smaller vessels. So we already seen that the pathways how the artery are branched into arterioles and capillaries. Then major arterial branches. So what are the major arterial branches? We have two. Head and neck, we have carotid arteries. Okay, the carotid arteries will supply the blood to head and neck. Then subclavian. Okay, so from the subclavian, axillary, brachial, and radial and ulnar. Okay, so these are the smaller arteries that supplies to the upper limbs. Then celiac, trunk, stomach, liver, spleen, and mesenteric arteries, then renal arteries. So these are the arteries which apply to the abdominal organs. Then common iliac artery, external iliac artery, femoral, polyptal, and tibial arteries. So these are the blood arteries which applies to the lower limbs. Then arterioles and capillaries. So these are the arterioles are smallest arterial branches. So which generally controls the blood flow into the capillaries. So major site of the blood pressure regulations happen in the arterioles only. So this is the major part which regulate the blood pressure. Then capillaries. This is the smallest arteries which where the exchanges happen. So nutrition, gas, waste, all the exchanges happens in these vessels. Then these are types. There are continuous, fenestrated, and sinusoidal. So these are the types uh, which are located in the different parts of the body. Then venous system. So as like the arterial system, we have venous system where the deoxygenated blood or the veins that carries the blood towards the heart. Okay, so all the blood that are from the body will be carried to the heart. They are called as veins. So these are mainly of thinner walls than arteries, so much thinner than the arteries. Then capacitance vessels hold 60 to 70% of the blood volume and contains valves. So major veins from head and neck. So internal jugular vein. So this is the main vein that take back the blood from the head and neck. Then subclavian veins which take back the blood from the upper limbs. Then inferior and vena cava and superior vena cava just before the heart, where the entire body of the blood will be collected in the superior and inferior vena cava, and the hepatic portal vein from the abdomen. Okay, so these are the venous system. So coming into the summary part. So what we have seen is route, how it is traveled from the left ventricle to aorta, arteries, arterioles, capillaries, venules, veins, uh, then capillaries into the superior vena cava and inferior vena cava, then into the right atrium. So this is the route. Then functions mainly it delivers the oxygen and removes the waste. Then also it is high pressure and high resistance system. Then we see arteries and veins. So arteries carries the blood away from the heart, and veins returns the blood to the heart. Then we saw the capillaries. This is the minute blood vessels where the site of exchange happens. So this is the end of the unit. Thank you.